More than 4 months under quarantine and with 70,000 COVID cases reported, the government wants stricter enforcement of health protocols. The president has ordered the police to jail violators in order to shame them and teach them a lesson. Will heightened law enforcement slow down the transmission? We discuss in this episode of the Chiefs. Welcome to this episode of the Chiefs, and with us right now are Ana Marie Pamintuan of the Philippine Star. Wala pa si Ami. Lucy Cruz Valdez, the head of News 5, and coming in a few minutes will be Robbie Alampay of One News. Good evening, and today's Tuesday.
Hello.
Happy Tuesday.
Yes, hi. Oh, so congratulations now to us. We are a mask-wearing people.
Yeah. Wag niyo lang wag niyo lang lagyan ng gasolina. At kung sakali pong lalagyan niyo ng gasolina yung mask, wag po kayo magsisigarilyo. Dahil mas delikado po yun. So, but those are things that I think we have to talk about later and qualify later kasi alam mo, people might take things literally and then you get into more trouble. So, quite a few things to talk about COVID. Well, actually, the whole episode is about COVID-19 tonight.
Yes, because the news coming from last night's statements of the president, and it mainly really focused on behavior, no? And how it seems to him, at least, na ang dami pa rin pasaway.
Well, totoo rin naman yun. Totoo rin naman yun.
Study, 9 out of 10.
Mm-hmm. Pero at the same time, napansin ko rin kasi at the same time, the president is a bit inconsistent with regard to wearing his mask. I mean, last week he took off his mask.
Minsan wala naman siyang mask di ba?
Oh, and pati si Secretary Duque nasisita sa social media kasi the way he wears his mask sometimes is not the right way according to health protocol. Anyway, let's welcome in Robbie Alampay and Ami Pamintuan from the port area. I'm sorry, from the Philippine Star office, the port area.
Tama rin naman yun.
Ito na kami, Ropor, present na.
Si Robbie kasi nasa Mandalo yung loob eh. So, what's the big story today or tomorrow? What do we see tomorrow?
Yan na nga, yung mask, no? Pinag-uusapan ngayon yung mga mask eh. Yung ibang bawal pala yung mahal-mahal pala nun.
Yung merong valve.
Actually.
Valve. Bawal daw yun. Bawal na nga sa medical city yun eh. Hindi na pinapayagan eh.
Yan na nga.
Apparently, pinapasok
it protects
yung
you.
valve na yun. Yeah.
But it does not protect other people around you. Kasi the valve is one way eh. You can sneeze and cough, and the droplets will go out the valve, and so you're a hazard to other people.
Spread.
And I'm sure kakalat din to, hindi lang sa balita, sa social media, but the president's own tips on how to handle reusable mask.
Yun na nga, pinag-uusapan nga namin, gasolina.
I mean...
Delikado yun sa mga nag-iossi,
Ang hirap, we don't know if he's kidding or not, but certainly some people might take it seriously no matter what happens. He did say it, kakalat yan. But certainly the WHO says, pagdating sa disposable mask, kaya po yung tinatawag na disposable kasi hindi yan reusable. And certainly, if yung pong pagbabad sa gasolina, I also would not recommend that. Without doing the research, I'm pretty sure hindi yan i-endorse ng WHO.
Hindi kaya parang rugby yan? Mahahay ka pagkatapos?
I don't know. Di ba?
Subukan mo yan. Ito, effective yan sa rugby.
But that's true. There are some, it does have an effect on some people. At the same time, of course, it's flammable. Di ba? All things you have to worry about.
Yeah. So it's a good way for you to stop smoking, di ba? Kasi pag mag-yosi ka, tapos anyway, why are we talking about
anyway,
that?
Of course, other than COVID, of course, malaking balita. We just read it at the big story, and as we'd expect, yung sa Bureau of Corrections, yung mga reported deaths. I mean, seriously, di ba? Among journalists, you have to start qualifying at least emphasizing these are reported deaths because even the Senate and even people in the executive are starting to cast doubt. How do we know na namatay itong mga high-profile inmates sa Bureau of Corrections? And the Data Privacy Commission has already
Yes,
said
that's the
na
conflict, no?
walang
Hindi
ano
mo nga
dito.
alam kung dapat ba nilang ibunyag. Kasi hindi mo nga ngayon alam kung ano bang susundin nila, data privacy law o,
Well,
di ba, full disclosure, no?
Well,
Natatakot sila eh. Yun ang ano nga eh. Natatakot sila because they might be accused of violations of data privacy.
does not apply. And even Harry Roque in Malacanang said, let's remember this is a public facility. This is a national penitentiary.
And they're in government custody.
Saka
And,
si Yusek Mark Perete, sabi rin niya na if it's imbued with national public interest, hindi kasama yung mga yan sa privacy. So dapat
and you would think since JB Sebastian was a star witness in a government case, government would be intensely interested in his health, in his whereabouts, and whether or not he is sick or dying. In which case the DOJ should have been informed nung nagkasakit siya o nung naghihingalo na siya.
Tapos ang report is ano eh, di ba? There are several high-profile inmates. So that
si Amin Buratong
yun, ano? Sino yung mga yun? Hindi mo nga malaman. Baka
dapat nung last month pa nag-ano na sila. Nag-i-inform na kung sino-sino yung mga namamatay. Ngayon lang confirm na rin yan ng Bureau of Corrections. Si Amin Buratong.
Yeah.
Nagpatakbo ng Tiangge.
Anyway, Ami, ikaw yung segue queen eh.
Oo nga eh. Kanina nandun tayo sa maska.
Kaya hinintay kita mag-segue.
kasi bili ko eh.
Baka naman may alam din yung guest natin tungkol dito. Baka naman pwede rin talaga.
DILG. Hindi, DOJ yung yung Bureau of Corrections eh. Anyway, let's bring in ang ating first guest for tonight is the Interior Undersecretary, si Jonathan Malaya, who is one of our regular guests on the Chiefs. Yusek Malaya, thank you po for joining us tonight.
Good evening.
Yes, hi sir.
Good evening everybody.
Hi sir. Oy, mukhang maganda yung internet nyo ngayon
Pati lighting.
Yeah, kasi I was in my brother's house at that time. So mas okay ito, nasa bahay.
Oo nga, sir. Sir, I'll start the ball rolling with the president's address last night. The president said huliin na ng mga pulis yung mga hindi nagmamask. Pero yun nga, we're more than 4 months down the line from the pandemic, and the IATF and the police have been arresting people without masks for the last 4.5 months already. So what's the difference between the president's orders now and what's been happening for the past 4.5 months?
Well, I think it's a reaction to the present situation. We're having around 2,000 cases every week. Every day, sorry, we have this. So
Every day.
Lumalabas kasi na because of that, malaki pa rin yung challenge natin on how to contain this. And given that we are slowly reopening the economy, ang epekto nito, of course, is dumadami yung mga possible infections. So we really need to be more strict dun sa ginagawa ng ating mga kababayan. We have to make sure that, they understand that they are not only threatening their own lives, but also the lives of their families and their communities. So I think yun yung context nung sinabi ng Pangulo. Kasi, be surprised, Ed, no, sa Cebu, ang taas-taas na nga ng COVID cases doon.
Yeah.
Pero during the ECQ itself, meron pang parada, meron pa tayong barangay captain na sinokos order doon. Dahil meron silang yung Santo Niño festival nila, no? So you very surprised yung mga ganitong mga situations. And we also receive reports na nagpa-swab na nga yung isang tao, the next day mag-golf pa siya. No? Yun yung medyo nakakainis kasi ikaw, nakasama mo yung tao, hindi mo alam na siya pala nagpa-swab because may nafe-feel siyang symptoms, and yet he goes around and talks to people. So I think that's the context of where the president came from.
Yes, sir. I think we all agree on the need for everybody to wear masks. Si Trump naman natin hindi eh. But even then, the president, a lot of people have noticed this. Even the president seems to be inconsistent when it comes to wearing his mask. during his public addresses. And when he makes his address, he's doing it with his cabinet, who are mostly composed of senior citizens. So maraming vulnerable people din around him. And this is the top leadership of the government. So pag may magkasakit dyan, hawa-hawa yan, malaki problema natin. So even then po, parang may inconsistency doon sa example being set.
Okay, I cannot speak, of course, for the president. I'm not the presidential spokesperson. So, sa ganda siguro, this is addressed to him rather than to me.
Okay, good answer there.
Yusek, linawin mo lang because you're talking about arrest, ano? In fact, the police have been rounding up people since the start of the quarantine for violations of health protocols. Ang ibig ba natin sabihin sa arrest is really a technical arrest? Ibubook ka, you will have a police record. Ganong klaseng arrest?
Well, since the beginning of the quarantine, madami na nga tayo na-apprehend. But we did actually arrest them.
Yes.
A vast majority of them were just fined and were just warned. Maliit na percentage lang yung ating inaresto at in-inquest, no? I think we have to clarify from Malacanang kung does this mean na ito ba ay, as you mentioned, na ikukulong na natin kasi we also have a problem with our detention facilities.
Yeah.
Oo nga
Just today, we received a directive of the Supreme Court upon our request actually na wag na munang ang mga courts ay pinagsabihan ng Supreme Court na wag na munang mag-issue ng commitment orders to the different Bureau of Jail facilities nationwide, which is run by the DILG, so as not to make it difficult because nga of jail congestion. Pero for the record, around 22,000 na ang naipalabas natin since the start of the AQ, no? Because of our decongestion program and also because of the new guidelines issued by the Supreme Court. So marami na ang nakinabang dito. But of course, because of the continuing congestion, ayan ang isa sa mga challenges natin. So makes our job harder if we are going to arrest people left and right, precisely because of our problems with the detention facilities, not only in the DPP, but also in the PNP.
Yusek, I was going to ask precisely about that Supreme Court directive. How does that work? A little more detail on that. Paano po sinasala? I mean, not all, but what will be the parameters and the protocols for determining who goes to jail, who gets detained, and who will be allowed to not go to those facilities?
Yes. Our request to the Supreme Court was precisely na wag na munang magpa-commit sa ating mga Bureau of Jail facilities because we're trying to keep most of them COVID-free. Many of them are COVID-free. Our COVID situation in the BJMP is really concentrated sa Region 7, no? Yung sa Quezon City natin na-contain na natin because we have isolation facilities for NCR. We have isolation facilities actually for most of the regions of the country. So we're trying to keep that unless of course wala talagang mapaglagyan, and our request is magkaroon muna ng PCR test yung detainee before they are transferred to the BGMP facility.
Yusek, sabi ni Presidente, mayors should do more. What do you think he means by that? What are you seeing mayors are not doing enough of?
That's a very difficult question. I think we need to increase our contact tracing, no? Because really the contact tracing is stopping the transmission, determining who the close contacts are, and then managing the COVID patients. That's really the three objectives of contact tracing. So right now, we're still awaiting for the budget coming from the Department of Budget and Management for our proposal to hire 50,000 additional contact tracers. Right now, we have 69,000 already.
Yeah. Oh, 69,000 contact tracers already?
Yes, but we're not really in a bad place because we have 69,000 contact tracers, which is a mixture of national government employees and local government employees. It's the LESU, or the Local Epidemiology Surveillance Unit, plus the BERTs, plus the PNP, plus the Bureau of Fire, plus NGOs. These comprise the contact tracing team. But according to the WHO, the ideal would be one contact tracer to 800. So to be able to reach that threshold of the WHO, we proposed to the Department of Budget and Management for the hiring of additional 50,000 contact tracers para umabot tayo sa
Oh,
120,000 contact tracers.
I
Mm.
see. I see. So it's okay. It's the figure dependent on the population of an LGU.
Yes, the more the higher the population, the more contact tracers we need. And in fact, si Secretary Anyo just issued a memorandum circular today advising all barangays to set up their own contact tracing teams. And the DIL can provide them training while we are waiting for the hiring of the 50,000 contact tracers that will come with a budget from the national government.
So, you said when we're
Yung ika-clarify ko lang kasi baka ma-aresto ako dyan sa not wearing a mask eh. Ma-aresto ba ako kung if I'm driving and I'm not wearing a mask?
Oh,
Am I-
actually, sir, yeah. Ang daming tanong dyan.
Oo.
Well, ang suggestion kasi namin, our recommendation is, kahit nasa kotse ka, mag-mask ka kasi you are technically
Kahit
going
naging
out in public.
Kahit
And at the
naging
same time, paglabas ko ng sasakyan, wala akong mask sa kotse, paglabas ko ng sasakyan, nakalimutan ko. So, it's best na suot-suot mo na siya, no? But that's our recommendation. But I don't really see a regulation right now na kailangan na sasakyan naka-face mask ka, except for the fact that everyone in public should be in a face mask. Now, going out in your car is technically you're in public. So you
Yes,
should
yes, po.
have a face mask. Now, however, ang aming request sa mga LGUs is magpasa kayo ng mga ordinansa nyo. What we want
Yun
is a universal ordinance across the country para pare-pareho yung amount ng fine, pare-pareho
Yun nga
yung
eh.
Yun na
sanctions.
nga. Anong
And
violation? Anong
we're working
violation?
on
Anong
that.
law? Anong law yung bina-violate? Kung aarestuhin ka, it's a real arrest eh. Magkakaroon ka
Yeah.
ng which law are you violating?
Right now, you're
Bayanihan to ilang buwan eh. Tapos na.
Right now, you're violating the ordinances. Ang dami nang nagpasa ng ordinansa ang mga LGU. However, iba-iba naman ang nakasulat. That's the
Yeah.
problem. Iba-iba
Right.
yung fines, iba-iba yung penalties.
Yes.
When we talked to the mayors last Monday, and we talked with all the leagues, the IATF had a meeting with the leagues. Ang sabi namin sa kanila, please mag-meeting na kayo, pag-usapan nyo na yung uniform guidelines natin para the entire country has the same regulations to follow.
Okay, Yusek, speaking of regulations and clarity in all of these ordinances, kamusta na po tayo doon sa last week na ang hot issue last week was itong house to house looking for COVID-19 positive people. May kalinawan na po ba doon sa protocols and sa implementation niyan?
Yes, Bobby, actually pinalaki lang talaga yung issue yon. Kasi kung babalikan natin yung press conference ni Secretary Anyo sa Taguig, that was the time when the drive-through COVID test was launched. Wala namang sinabi doon, it will be the police only who will go around doing these things, no? At wala namang sinabi doon na house to house. But habang lumaki yung istorya, naging police operation, tapos naging house to house na, tapos sinakyan na ng lahat. So we immediately clarified that it will be the local health workers led by the local epidemiology unit who will do the house to house. Kasi wala naman po sa amin yung listahan ng mga COVID patients. The list is the city and municipal health office. Therefore, paano naman ang police ang gagawa niyan? Pangalawa, ang dami-dami ng mga police na nagkaka-COVID. So, because they're the ones doing the quarantine, implementation of the quarantine protocols. So, definitely, it will be the health workers who will take the lead. Pero dahil sa ang dami ng sumausaw sa issue, gumulo, no?
Okay,
So,
so sir, linawin na natin yan. We're taking the police out of the equation, whoever it is. It's still a question of protocols. How exactly is this going to be carried out? Even assuming that it's going to be the barangay health workers. Ano po itsura nito once it rolls out and it's being implemented in our neighborhood?
Yeah, it's been done. It's now being done since last week. First, the local health workers or the local epidemiology surveillance unit who has that list of COVID patients will go visit the house and determine kung yung guidelines for home quarantine are being followed. Meaning, may sarili siyang kwarto, may sarili siyang CR, at walang mga nakatira sa bahay na may mga comorbidities. If the patient has that kind of condition, walang problema, he may continue to do home quarantine. Doon lang tayo sa mga walang ganong klaseng facilities, yun ang linilipat natin. And we have been doing that already. Even the Bureau of Fire Protection has been mobilized by the department. Kasi meron tayong mga emergency medical services and special rescue unit sa BFP na may kumpletong PPE, may mga ambulansya. Tumutulong po sila sa mga local government units para ilipat itong mga COVID patients sa mga isolation facilities, either nationally run or locally run.
Yusek, I think naman everybody agrees on the concept, on the need to do this in principle. But baka naman the confusion arises from the use of the phrase house to house. Like for example po, sabi niyo kanina, hindi naman ginamit talaga yung phrase na house to house doon sa sinabi ni Yusek, ni Secretary Anyo. Pero at the same time, a few sentences later, ginamit yung phrase na house to house ng barangay health workers. Kasi yung connotation po ng house to house is iisa-isa yung mga bahay. And I think what you just mean is na pupuntahan sa kanilang mga bahay yung mga identified already na COVID-19 patients.
Correct. Di ko ba alam kung bakit. Siguro it's because of the charged political atmosphere. Nagpanic agad yung mga tao. Akala nila police operation, military style operation, na dadamputin, dadalhin. Tapos yung mga kritiko ng Pangulo, sumakay na, tokhang na daw itong ginagawa ng PNP at ng DILG. So nagkagulo-gulo na. So again, we have been emphasizing na maybe na nagkaroon ng misinterpretation, maybe it could have been said in a more clearer way, pero that was never the intention of government, and it was never said by Secretary Anyo that it will only be the police who will do that, nor did he say the words house to house. As you mentioned, it was said in the context of the barangay health workers. Kasi nga since magkakapit-bahay kayo, parang ginagawa mong house to house, but hindi naman talaga yun yung gustong papuntahan ni Secretary.
Kasalanan ni Ami yan eh. Kasalanan ng media yan.
May direct
Tama na. Okay, enough. Sir, gusto kong pag-usapan yung cha-cha.
Okay.
The municipalities has passed a resolution. I think 1,500 mayors, and you seem to be in favor of it at this time of pandemic. I think that's the main issue, yung timing. Bakit ngayon? It's very divisive. That's what the critics are saying. Why?
Well,
why now? Why at all?
Ang mahirap kasi dito sa isyong to, parang it's never the right time. It's laging ganun. Kung walang pandemic, sasabihin naman,
yes,
ganito.
But Yusek, pasensya na, in any other normal time, that's a valid thing to say. It's never the right time. But I think you would agree, this is the worst time to bring it up.
No, not really. If we were to say na we will do campaigns, we will do information advocacy campaigns going around the country, asking people for support, then I will join you and say it's not the right time. But ang gagawin lang naman natin dito is we will talk to Congress, and Congress will open session on Monday. So we will just talk to Congress, give them the resolution, explain to them what the merits of this proposal, and get them to move. There will be no information dissemination program that will be done because we're under COVID. I guess the information dissemination or education campaign will come later once Congress has passed already this, if it decides to do so. So once this is done, then we will have to go to the people in a plebiscite. But in the meantime, it is just discussing the merits and demerits of the issue. Ang frustrating kasi dito sa isyung to, and we have been discussing this since we were in college, every time pag-uusapan, there's always the claim of, ulterior motive yan, no L yan, ulterior motive yan, term extension. Wala naman po yan sa mga proposals. Even if you look at the proposal of the League of Municipalities, they never mentioned term extension. They never mentioned no election scenario. Because precisely, Ang sinusulong ng LMP, which the DILG supports, are surgical amendments, small amendments to the Constitution, which we feel will make our country stronger if we have similar situations in the future like a pandemic. Because ang pinaka purpose lang naman nitong ating ginagawa is for regional development. We want to solve the unequal regional development that we have, where our GDP is concentrated in Metro Manila and in the region surrounding it.
Can you
Pero
explain
sir,
to us why this is even necessary, given that there's already a Mandanas ruling?
Okay.
Diba? Supreme
Sige.
Court ruling na eh. So
Yes.
kung tutuusin, di ba pwede na execute yun? Yung
Yes.
IRA na kukunin sa national budget or na
Yes.
hindi na kailangang i-confine lang sa BIR collections.
Yes. Ang punot dulo kasi nito is the ambiguity in the wording of the Constitution. Ang wording kasi ng Constitution natin is just share, okay? And then it's worded na taxes, but it was not really clear kung ano ba yung scope of taxes. And when it was interpreted by Congress through the local government code and by succeeding administrations, it was limited to internal revenue taxes. So the members of the leagues had to go to the Supreme Court, and it took them how long? The Constitution has been there since 87. It's already 2020, no? Lumabas yung decision last year, if I'm not mistaken.
Yeah.
So yung ambiguity ng constitutional provision is the meat of all of this. And our intent is to clean up the ambiguity para hindi na mangyari itong ganito. That's the first.
But you say precise. I mean, just to repeat your point, but the Supreme Court did rule on it. I mean, there is no ambiguity. I mean, they did give direction. No, but just to your other point, no, it's good that you acknowledge the distrust that people have on the process itself, not just this government. Any government that has floated constitutional change, people ascribe ulterior motive, Noel, term extensions, and so on. And that does not disappear with anybody's reassurance that we're not going to touch it. Because the argument from the very start, even from our college days, as you pointed out, is precisely that there is no such thing as a surgical attack on the Constitution and constitutional changes. You open that can of worms, there is bound to be at least one person who's going to bounce. And we will be surprised if only one person suggests Noel or term extensions.
Or term limits.
Let me address muna yung issue mo about the Supreme Court has ruled already on it. Okay. But the Supreme Court can always change its mind. And we've seen that in so many cases already, nag-flip-flop sila. So it's entirely possible that a new president may come in later and say na, okay, I don't want all of this money going to the LGUs. And then we'll, change policy either through the local government code or through, I don't know, whatever, no? Alam mo naman sa ating bansa, no? So we want to fix this. We want to put this in stone to ensure that the just share of local government units and the base upon which the ERA is taken is in the Constitution itself. Now, there is a difference between the situation now with the situation, for example, nung panahon ni Ramos, no? Kasi you're mentioning our college days. So, nung panahon ni Ramos, Chacha or amendments to the Constitution came towards the end of the term. So at that time, very obvious na it was for purposes of perpetuating whoever, the powers that be in power. But dito sa panahon nito, under the Duterte administration, constitutional reform or other forms of constitutional amendment has always been on the table. Even before the president ran, sinabi na niya yan na ang gusto ko ay baguhin natin ang ating saligang batas, no? So it's really part of the agenda of change of the administration. So of course, tama ka, when we open up one provision, it may open up a can of worms. And ang maganda naman sa atin, we have two chambers. There's the Senate. So kahit anong mangyari sa House, if the Senate does not like it, wala naman mangyayaring which happened already during the first regular session during the term of Speaker Alvarez when a resolution was passed and it did not pass the Senate. Ang sinasabi ko, this is already the last 2 years of the administration. The administration is putting forward a package of reforms sana naman pag-usapan natin yung merito, hindi yung questionin yung motibo ng mga tao. Pag-usapan natin yung merito, no? If it doesn't pan out, fine, no? But we want to put this on the table, and hopefully, sa tingin namin, these surgical amendments are really necessary for us to progress as a nation.
Yusek, I just noticed you keep saying we, ha? You are representing the DILG, ha? So you're supporting the mayors. Pakababanggitin ko lang, in-interview kanina si League of Municipalities President Chavit Singson, and he was saying he wants lifting of term limits and a 5-year term for local officials. He wants a lifting of all term limits sa local officials. Sinabi niya kanina yun.
Yeah, sinasabi kong we because this is the position of the DILG, and this is the position of the Task Force on Constitutional Reform. There's this body which was created by the President around 2 years ago, who is studying these proposed amendments. Now, si Mayor Chavit personally is in support of 5 years, no? A 5-year term.
5 years and no term limits.
Okay. I think wala pang posisyon ng LMP on that. Kaya nga wala naman dun sa resolution nila. I think he was expressing his personal opinion. Pero if you ask me, I would also support a 4-year or 5-year term for mayors. We have seen it in the DILG. Yung mga mayors, tatlong taon lang ang term nila. Yung first year nila, inaalam pa lang nila yung trabaho nila. And then yung pangalawang taon ay they already went to the learning curve, mas alam na nila yung trabaho. And then come third year, election na naman. With elections every 3 years, the election cycle has become the most predominant feature of our political life. So, hindi talaga nakakatulong sa governance ang madalas na eleksyon. So, if we are asked, for example, by Congress, but this is not in the proposals, if we are asked by Congress, if we support increasing the terms of public officials, we would agree that elections held every 3 years is counterproductive to governance. Kasi ang nangyayari, politics becomes the main feature of governance because lagi mong iisipin, election na naman sa susunod na taon, I cannot do anything which is not popular because of, as I said, elections being the predominant feature of any local politician's life.
That's precisely
theoretically, just on the proposal to take away term limits, will it apply to the current incumbents who are already running up on their limits? Will that take away their limits now and applying, by the way, not just local officials but all the way to national positions to the president?
Yeah, when you talk about term limits, you're talking about the 3 consecutive terms.
And the 1 term of the president. I mean, to be explicit about that, the single term also for the president.
Yes, we do not support that. It's not in our agenda. We have not submitted any proposal to that effect to Congress. Ang sa amin is more of the longer term of a public official from 3 years for local government officials, maybe to 4 years, or kung mas mabait tayo, maybe 5 years.
Yeah, but I'm not asking what you're supporting, but theoretically lang, if somebody proposes na i-lift ang term limits, and let's say na-approve lahat yan, does it apply immediately to the next elections kung umabot doon? I mean, burado ba yung term limits sa lahat ng incumbents ngayon? Is that how it's going to work?
Well, perspective yan, di ba, Yusek?
Pero hindi ko talaga alam ang sagot because we have not thought about it because it's not part of our proposals anyway. Pero that would be, I would agree that it should be prospective. Kasi it should not apply to those who are sitting now.
Yes.
So kung ako, kasi right now, I was elected under the provisions of the 87 Constitution. If the 87 Constitution says that after 3 years, I should go down, then I should go down unless the transitory provisions of the Constitution says otherwise. However, walang transitory provisions dito dahil we're not amending the entire Constitution. We're just amending some provisions. So I do not see any scenario wherein there will be complex transitory provisions kasi nga nakatutok lang naman tayo sa IRA, nakatutok tayo sa lifting of foreign direct investments restrictions and some very small surgical amendments.
Okay.
Okay.
All
Maraming
right.
salamat, Yusek
Thank you,
Jonathan
Yusek.
Malaya of DILG. Sir, thank you for joining us tonight.
Salamat po.
Thank you.
Maraming salamat. Mabuhay kayo.
We will just go into a gap, so please stay with us.
Welcome back to the Chiefs. We're now in the final stage of our conversation. And now joining us are public health consultant, Dr. Troy Hepte, and organic intelligence behavioral change expert, Dr. Jason Ligot. Good evening, doctors.
Good
Good
evening.
evening, Abby.
Chiefs.
Hi, Doc.
Evening, docs.
Yes.
Good
Hello.
evening.
Okay.
Abby, Ruby,
Let's
Yoshi.
start off at the start of this episode. We were talking about the regulation for wearing masks. We are being reminded na baka ma-aresto tayo kapag hindi tayo nag-mask in public. Ano bang posisyon ng mga doctors about mask wearing? I know na dito sa Pilipinas, there's general agreement naman that we have to wear mask. But in other countries, the debate continues na hindi daw advisable in certain areas, in certain activities na mag-mask. Tapos meron na naman dito na bagong na yung meron daw vent. Di pala maganda, binana
Wow.
ng medical city. Oo. Ang dami nang bumili no ng mahal-mahal. Ano bang position, doctors? Maybe we can start with you, Dr. Hepte.
Yes, thank you, Ami. And I think yung issues or concerns about yung pag-wear ng mask, especially for the other countries, I think may yung iba kasi merong parang nararamdaman na feeling nila may encroachment on their personal liberties. Kasi they might pretty well do as much as they please kung saan man sila pumunta, and they want to be consistent lang with what they believe in. But here, it's very clear in the Philippines. We are standing by what our public health advisories have been provided for by the DOH and the WHO. They have said that as long as hindi natin kaya ma-maintain yung physical distancing at magkakalapit tayo, may chance, may opportunity na magkumpul-kumpulan tayo, mas mabuti meron tayong protection na magkaroon tayo ng mask. This will have parang an effective, it will be an effective barrier against yung pagkakaroon ng infection. So, very very clear naman yung ating mga advisories, and we have to be consistent. It's just that, ay napapansin din natin ito, yung mga tao, hindi lang talaga tama o sapat yung pag-wear ng mask. Minsan, nasa ilong lang yata, nasa ibaba,
Yes.
nasa baba.
Yeah.
Yun ang natin i-remind sa mga tao. Lalo na kung magkakasama sila, i-maintain talaga nila yung proper use of the mask.
Yes, so
Ang dami na kasing klaseng masks eh. There's so many masks in the market and so many people have so many choices. Give us some clarity here. What kind of mask should what kind of people wear or buy?
Yeah, for I'll just be discussing two masks siguro. Yung isa yung N95, we have to reserve it for our healthcare workers.
Yes.
Kasi this will give the highest kind of efficiency for the barrier against yung sa mga viruses natin. The other mask, yung surgical mask or face mask, we can use that in the public or in the workplace or in the household. Kung nag-iingat tayo na hindi tayo magkahawa-hawa, at least makapag-provide ng barrier. It has some kind of protection, yung may konting film siya that will be a good parang deterrent for kung merong moisture or merong pwedeng pumasok na droplets dun sa ano na yun, sa barrier ng
Opo,
mask.
Doc.
So, ito
Pero
yung
Doc, if I may, Doc,
advice natin.
if I batin, Doc, kasi ang mas common ngayon sa mga tao, kasi disposable yung surgical mask eh. Ang mas common ngayon ginagamit ng tao,
Cloth.
yung kung saan binibili. That's
Cloth
what I mean eh.
mask.
That's the more
Yeah,
common one eh.
kasi
Kasi
washable.
nalalabhan. So
Yes.
when it comes to that, what should people watch out for?
There's still parang research and nag-grouping evidence about kung ano yung effectiveness of this mask, yung mga cloth mask na ginagamit natin. But as we are waiting for that kind of studies or mga research na yan, it's better for us to be able to have some kind of parang protection na pwede maibigay sa ating mga kababayan. So, yung ibang mga mask kasi lang, ang problema, may mga malalaking siwang, yung mga para mga holes. Kaya dapat nakalapat siya. There are a lot of advice, I think, kung paano isusot din yung mga mask na yan. And if it's ill-fitting or loose-fitting, dapat palitan natin siya. Yung iba kasi napapansin natin, habang nagsasalita, nahuhulog lagi yung mask.
Mhm.
So, there are better fits for that. I'd just like to add pala one more thing about yung mga may valves. Those are used kasi for occupational parang settings. So, yung filter na nandun sa valve na yon, hindi siya ganun ka-effective or efficient against yung mga viruses. Kaya, I think there has been a clarification about that.
Dr. Ligot, if you don't mind, my question is to Dr. Ligot. Yung sa science, we leave that right now doon sa ano na, whatever it is, we know that masks help, the very least. Diba? But Dr. Ligot, you're a behavioral change expert. Maglilimang buwan na, mangangalahating taon na to, why are we still talking about masks?
Right, that's a great question, Robbie. No? But actually, based on global polling data, the information shows that Filipinos are actually generally compliant with the public health advice. In fact, according to a global survey, we're one of the highest in terms of people who say that they wear masks outside the house and that they
So hindi tayo
with-
pasaway. So
Hindi tayo pasaway. And
Okay.
I think that's parang that's a relatively tempting narrative to point no that the problem is a lack of discipline, that people are not following the advice. But actually, if you go by the data that we have, people are generally compliant with the advice that is being put out by public health authorities. Now, however, and this is something that Dr. Troy Hepte mentioned, saying that you practice the advice is different from whether you do the advice as properly. Diba? I mean, people might say that yes, they do wear the mask outside the house, but whether or not they're wearing the mask properly, whether or not they're following appropriate distance, that's a totally different matter altogether.
So pwedeng pasaway tayo.
No.
I think the bottom line here is it sounds very simple when you say that you only have to practice 4 behaviors, diba? To protect yourself from COVID. Keep your hands clean, maintain appropriate distance, wear a mask, and cough properly. But in reality, those behaviors are actually very difficult to master and to make a habit in daily life.
Right.
You know,
Yes.
what matters in what we know from behavioral science is at the end of the day, what matters is complexity, how complex the behavior is, and context. Where and when and how do we expect people to practice these behaviors?
Well, yun na nga yung tanong ko rin, no? Of the 4 behaviors in this protocol, which one do you think is the hardest to actually comply with? Is it the proper wearing of the mask? Is it the social distancing? Is it the washing your hands for 20 seconds, which is a lot, especially for women, because every time we go to the John, we're trained to wash our hands. So we waste a considerable amount of time washing our hands. But so among the 4 behaviors, which one would you say is the most difficult to master?
That's a great question. But the reality is it's very difficult to rank which behavior is more difficult to practice compared to the other. I think the reality is all of these behaviors sound simple in theory, but they're actually very difficult to practice. I'll give an example. social distancing or physical distancing, we say that people should maintain a 1 meter distance from each other when you're going about your daily life or your daily activities. But what is 1 meter really? How do you know that this is 1 meter? How do you eyeball that? It's very difficult for
Yes,
people to
yes.
make that calculation in every instance. And also, the reality is there are situations that it is nearly impossible for you
Yes.
to maintain that distance. If you go to a crowded place, for example, or you some public transport, some public forms of transportation, it's practically impossible to do that. So for me, actually, the question is, should we even expect or should we even put people in these situations when we know that it is difficult for these behaviors to be practiced? And that's a question for governance, I think. Should we be even exposing our citizens or the population to situations that it's practically impossible for them to even follow the advice?
Dr.
Oh, wow.
Heften,
But
I want to follow up a question I asked earlier. Do you advise people to wear a mask if you are driving alone in your car? Also,
Siguro
Yeah.
do you
nahuli, siguro nahuli si Ami.
hindi. Also, do you advise wearing a mask if you are jogging? Kasi nahihirapan daw yung mga jogger na huminga kapag nagja-jog eh. Pwede ba yung face shield na lang pero walang mask kung nagja-jog?
For joggers,
Yes.
actually,
For jogger, saka kung nagda-drive ka alone in your car.
Alone in the car.
for joggers, unahin ko. Yung, I think the question there is really about yung difficulty of wearing the mask. I think you're right.
Yes.
I think we should try to get the advice of a healthcare worker, doctor or nurse, or someone who's in the know kung magkakaroon ba sila ng difficulty. For all we know, yung tao pala merong respiratory condition and
Yes.
yung pagkakaroon ng mask and then while jogging, that might be detrimental to their health. So, it's something na parang case-to-case basis. But having said that, I would agree, Jerry, na kung pwede, if you're going outside, as much as we go outside to walk, to go to work, to commute, and if you're going to do some physical exercise or jog, mabuti may protection talaga tayo. Na alam ko that will be hard, pero we have to pace ourselves too when we go out. For that thing about yung sa drivers naman, I think ngayon mas magiging magipit tayo kasi dati, pag nag-iisa ka lang sa kotse, parang pwede yata nawala. Pero ngayon din kasi, hindi natin masabi, baka inside our vehicles, maybe baka may pumasok na virus from outside when we open the car and we closed it. Baka the air inside the car is parang recirculating, paulit-ulit. So we just maybe have that kind of protection also. But when we pass through siguro mga checkpoints or when we pass through yung mga entrances of establishments using our car sa mga parking or dun sa kung saan nag-check yung mga local enforcement officials natin, I think mabuti na rin na hindi ka na kailangan magpabalik-balik na tanggal baba o kaya susot na naman. So mabuti na nandiyan na lang siya pirme for the meantime. So it's still a little fluid dun sa how we will have this advisory. I fully agree with Dr. Jason na talagang we should try to rethink about or reconsider kung ano yung mga paggagawa natin talaga sa ating mga kababayan. Kasi kung hindi naman talaga ganun ka-effective, we just have to come up with good feedback mechanisms to again look at our policies, our guidelines, and see what really works. And referring back to our question kanina about yung tungkol sa mga behaviors, Ma'am Lucci, I think
yes.
yung social distancing is the really hard thing, yung how to estimate yung 1 meter, 2 meters away the distance. And people really have a tendency to come closer together. Kasi hindi tayo makaintindihan, may mask na nga, tapos hindi pa tayo nagkakaintindihan.
Actually, Doc, gusto ko ang i-follow up. One of the frequent questions asked by family and friends is, tsaka dumarami na rin talaga, like Michael V, he was saying in an interview na he doesn't know where he got the COVID because he hardly stepped out during the quarantine. And marami nga nagtatanong, Doc Hepe, Ano bang rule talaga pag meron kang kasama sa bahay na mag-grocery? Pagdating ba niya, dapat ba magpalit siya ng shoes, magpalit siya ng damit? Dapat, ano bang rule doon para hindi mahawa yung the rest of the household?
Yeah, I think every household has to remember na if we go outside, may protocols tayong sinusunod, the workplace, sa mga malls, establishments, commercial areas, pati sa household dapat may protocols din tayo eh. Kami, we remind each other sa bahay na when we go out of the house, we leave our shoes outside the door dun sa parang area kung saan kami pwedeng mag-disinfect dun sa shoes or sa mga sandals namin or slippers that we use para talagang may pag-iingat lang. And when we bring things from outside to the house, we also try to spray or mist yung mga binibili nating mga packaging with the things that we buy, yung mga items natin. If possible nga, lilinisin mo siya if you're not really sure na okay yung pinanggalingan nito. Kasi nga, maaaring pwede maging through contamination and then inadvertently you might touch your face, your eyes, your nose.
Actually,
dun sa situation na yun.
Right, Luchi, if I
Doctor,
could
you
add,
brought up-
no?
Dr. Ligo.
We actually based on what we know about how people remember, we tend to overestimate how compliant we are with these pieces of advice actually.
Really?
And underestimate how many times we actually don't comply with the advice. So, and this is sort of related to Ami's question earlier about whether you should be wearing a mask inside your car. I think the overall approach should be to keep it as simple as possible. Remember, what we're trying to do here is we're trying to build healthy habits, and habits are formed by repeated action over time. So if you add too many exceptions that, okay, you wear it in this situation, you don't wear it in that situation, this situation is safe, that situation is not, it becomes very difficult for people to make that calculation on a daily basis because you have to make that decision every day. So, as a general principle, I think the simpler the instruction is, the better. People will practice it more and it becomes second nature to them.
Dr. Ligat, I'm curious about that because kanina sinabi niyo nga na there's a dissonance between what people will acknowledge is the proper thing to do and what they actually do or don't do. And you mentioned that this is certainly true for the Philippines. You mentioned the studies that you're looking at, but the studies that you're looking at also show a comparative the comparative distance or disconnect in other societies, in other cities, in other populations. Are they more consistent in how they think and how they act? And what are they doing differently? Is it that their discipline is different? Is it that their infrastructure is different? Kasi I imagine there are the best performers among people, and then there are those who are not as good as them. What's the difference?
That's a great question. And I think it goes back to my earlier point, the one that I made about context. We tend to put too much emphasis on personal discipline when it comes to evaluating whether or not people are practicing the behaviors we want them to do. When in fact, it always occurs within a certain context, a certain environment. What that environment is, it can be your house, your school, your workplace. And this is where government, I think, comes into play when it comes to putting out policies and whether or not these policies are actually implemented. We should work under the assumption that you will never get 100% compliance with these target behaviors. And so you have to have the appropriate environmental supports, environmental nudges and structures to encourage or reinforce this behavior. Unfortunately, I cannot say with certainty based on the data that I know whether other societies are complying more better than we are. I can only reflect on our own particular situation. And what I can see in the environment is, simply put, Filipinos, I think a lot of Filipinos are placed in situations where, whether they like it or not, it will be very difficult for them to practice these behaviors.
Like what are those particular situations that you feel government should be directly addressing?
For example, when it comes to public transportation, I think there's been a lot of discussion about reconfiguring public modes of transportation,
Yes.
etc. I think th- obviously that's it's a very difficult and complicated
Yes.
situation, but
Yes.
should we even require or should we even allow people to be moving so freely? I think that's a discussion we have to be making. And
Yes.
then workplaces. In fairness, I don't think the government has been remiss in putting out guidelines. So let's be clear about that. There are guidelines for many different situations, but the problem, I think, the gap lies in the implementation and whether or not these guidelines are actually being followed. And in this regard, we can work, I think we can, there's a lot of space for working more closely with the private sector, with other sectors in ensuring that these safety protocols are in place.
I think one of the more recent controversial ones has to do with the back riding, no? And that
Yes,
barrier that they wanted to put between
right.
the driver and the passenger. What do you think about that? Really, should that even be allowed?
Well, I'm not an expert in mobility, but I have read some opinions that, whenever you place any additional accessory in a motorcycle, the bigger risk actually is for road crashes because then the driver has to
Oh,
reconfigure the
yeah,
balance of the motorcycle as
exactly.
opposed to the risk from exposure from COVID.
Okay. Yeah.
Personally, I think if you're wearing a mask while you're riding a motorcycle, that's enough protection.
So
Dr. Lee,
siguro
do
yun
you
ang
see
dapat i-review.
some of these practices becoming permanent? I ask because in some societies like in Japan, in Taiwan, in Hong Kong, we've seen a lot of people wearing masks a long time before the pandemic even. And even in their lavatories, public lavatories,
Right.
in Japan they have a alcohol dispenser. They've had that
Mhm.
there for years. You think some of these practices will endure beyond the pandemic? Seeing
I
what
cer-
you're seeing in the
I
past 4 months.
certainly hope so because you're correct. I think these societies where these behaviors are practiced more openly and people are more accepting of these advice, it's also because of their previous experience. You have to remember, in many of these places, they had to contend with SARS
SARS, yeah.
in a very big way. And because of that, the population has been sensitized to a certain degree to practice wearing a mask, practicing appropriate distance, keeping your hands clean. So I certainly hope that many of these behaviors and many of these recommendations endure even past COVID.
No more handshake, no more beso-beso, ganun ba yan?
Oh,
Well,
forever.
I,
Oh.
No
I
handshake,
think,
no beso-beso. You think that will
well,
Ganyan lang tayo,
well,
Korean. Annyeonghaseyo.
ano na nga?
I think that's
Before
a
we
different
before
a different topic, but yeah, I think there's some of these behaviors I think that we should be practicing with or without the pandemic anyway.
before we end, and we are running out of time. I did want to ask Dr. Hepte. Dr. Hepte, on the science side, on the research side, I mean, can you give us an update on where the world with regards to understanding and hopefully finding a solution to COVID?
Yeah, thanks, Robbie. I think talagang nakatingin pa rin tayo dun sa kung pwede tayo magkaroon ng news or updates about a vaccine that might emerge sometime, ano. And a lot of companies, pharmaceutical companies, are really staking their claim on finding the correct candidate vaccine, kung ano man yung makita nila, tapos iti-test nila to. So far, meron na mga a few vaccines, candidate vaccines na nag-undergo na ng phase 3 human trials, mga clinical trials ito. But we will still rely talaga on the effectiveness of how we will try to set those public health measures in place, what will really make sense and what will be most effective in a nationwide scale. So ito mga social distancing natin, yung quarantine measures, I think every country tinitimpla nila eh. kung ano talaga mag-work for them. Those who believe na magkakaroon ng herd immunity, like some of the earlier countries like Sweden and the United Kingdom, medyo hindi siya naging successful kasi they saw na maraming naging mortality at their economy also suffered for it. And tayo din naman, hindi naman tayo gaya ng South Korea or ng Japan, who has really gotten that kind of routine or vibe kung paano ba talaga makukuha natin na yung behavior na angkop dun sa ating mga kababayan. I think dun sa nangyayari sa atin, medyo chumachamba pa tayo ngayon eh. Nakikita pa natin na baka mag-work ito, pwede na ito, pero talaga we have to be very strict. Sometimes when I drive around, I see there are a lot of neighborhoods na ang mga tao talaga, hindi talaga realistic na ilalagay mo sila sa bahay nila kasi dikit-dikit mga bahay nila. In the first place anyway, talagang ganun talaga yung situation nila and it will not really be possible for them to maintain all of those public health measures that we are advising in this community quarantine levels that we are advocating for. So we are really going to rely dun sa non-pharmaceutical interventions. Having said na may vaccine tayo, we are still looking for the correct kind of treatments, yung mga drugs and medicines. And so far, we have good antivirals na and we just have to sort out yung dami ng information and madaming claims about yung effectiveness of these medications that they are saying, yung mga steroids ganito o kaya kung anong kind of supportive treatment. So researchers really help give us that kind of evidence. We will try to base all of our judgments and policies based on those hard evidence.
Now, Dr. Troy, you mentioned kanina kasi the possibility of a virus circulating inside the car. I'd like to bring it back there. I'm wondering now if there's any clarity on whether the virus is airborne. Kasi I remember when this all started, the DOH and WHO, they were unanimous in saying that it is not airborne. And over the past few months, parang there are some questions being raised that baka it is airborne. So are we now looking at the possibility that it's really airborne?
I think there are developments where WHO has also tried to consider yung mga statements coming from a group of scientists to reevaluate kung ano yung possibility of having this kind of transmission. We always maintain kasi na respiratory droplets siya, but
Yes.
in limited settings, in hospitals,
In hospitals,
where they
for
have
example, yeah.
procedures, di ba? Ito yung pinag-uusapan natin dati na may aerosolization of the virus or baka meron tayong mga droplets pala na na-aerosolize and then nagiging micro-droplets siya. And if they are dun sa droplet nuclei, ito yung mga dust, kumakapit dito, baka madala siya ng hangin. So I think we still have to establish yung evidence for it. There have been limited studies and it shows na medyo parang mukhang totoo nga na may kinalaman yung airborne transmission or yung aerosolization. So I think WHO is still open to it, but having no evidence na clear pa at this time, they are providing that kind of precaution na dapat talaga pag-wear ng mask. Before, medyo they were a little iffy about it, but now it's more clear na we have to wait for more evidence. As we do that, kailangan talaga natin mas magkaroon ng maraming protection.
Mm-hmm. Okay. Well, maraming salamat po, Dr. Troy Hepte and Dr. Jason Ligot. Docs, maraming salamat po for joining us tonight. Thank you po for your time.
Thank you.
Thank you.
Salamat
Stay
po.
safe.
Stay safe.
Stay safe po.
Lagi
And that will be all for this edition of the Chiefs. We hope to discuss here. We'll keep the conversation going. I'm Edwin Gaupan News.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay and we are One News.
Tagal ko na